Hi, everyone. Thank you for joining. We will be discussing the Genetic Alliance Biobank grant application here on the webinar. And my name is Kristen Queen Schaefer. I'm the Grants Administration Director. And I'm joined by Liz Horn, the Director of the Genetic Alliance Biobank. We will both be giving you an overview of the biobank, what we do with the biobank and all the great stuff that is being accomplished there. And also we will be giving you a sort of snapshot and rundown of the application and grant that is available to organizations looking to begin their own registry. It's Kristen Queen Schaefer and Liz Horn speaking with you today. So we are going to, just to give you a little rundown of the agenda, we will be, again, we're going to start with Liz. She's going to give a brief introduction to the Genetic Alliance Biobank. I'm going to give a quick introduction as to how this grant opportunity came about. Then we're going to go quickly through the grant guidelines and application, and then we'll have a quick question and answer session to give you time to send us questions, and we'll hopefully answer everything that you need before applying. So Liz, we're going to turn it over to you and have a quick rundown of the Genetic Alliance Biobank.
Perfect. Thank you, Kristen. So as Kristen mentioned, I'm Liz Horn. I'm the director of the Genetic Alliance Biobank. I'm a scientist by training, but I've worked with advocacy organizations for the past 7 years and have a lot of experience setting up registries and biobanks. So this really can be a challenge. It's not something that is easy to do, but it's something that's very needed for the community. So what our vision is to revolutionize access to information and resources to enable translation of research into services. And we do this by providing registry and biorepository solutions for advocacy organizations. And we believe that by doing this, we can catalyze research for treatments, something that's needed across many conditions and diseases, both rare and common. And how do we do this? We set up a co-op model where we can build an extensible interoperative biobank or registry. And we've done this in a cost-sharing way. We started in 2003 because it can be very burdensome for one organization to take it on their own. And when we began off the backbone of the PXE International Biobank that was founded by Sharon Terry, who's also the president and CEO of Genetic Alliance. And we formed an advisory committee. And at the time, we were an advisory board, but we formed this group to help make decisions, identify vendors, and try to come up with the best infrastructure and solution. Because we really believe that if we develop the infrastructure and solution, then the member organizations can concentrate on what's important, recruiting participants within their community, working with their community, and asking the right questions to get the information needed to forward research for their group. And so what we've done is we've built the Genetic Alliance Biobank, which has, it's a co-op, as I've mentioned. We have member organizations, and we have the ability to collect clinical information and biological samples. We have a biobank. All of our groups right now are banking samples, but it's possible just to use the registry components. One of our groups is not collecting new samples. They're just collecting new information. We've also added lots of training modules, which I'll mention, boot camps. We have some webinars and some different things. And really what we've tried to do is to put together a system that any group can use. And we've done this over many years, and we started in 2003 with just the sample repository. In 2006, we were able to add the registry component. We have an online web questionnaire. We've been working with the database of genotype and phenotype for our member organizations to be able to deposit their information there. And we now have this, in 2009, we added a really unique data mining tool that allows us to develop cohorts and and visualizations in order to do natural history studies and clinical trials. We're also launching dynamic consenting and through a company called Private Access that will happen this spring. So the way we've set this up, we have an advisory board that represents all of our members, and we come up with infrastructure, and we continually update and change things as science and technology improve. And we've made some significant changes over the course of our history. Our members bring passion, skills, and resources to the collective, and we're able to leverage collective resources. And obviously, as membership increases, more services are possible. But the really unique thing is that the members, they govern and steward their own collections. So they maintain all the control. They determine what should be collected. They determine who will have access to it. And this is a platform for cross-disease research, which is very exciting. So if you're a member of the Biobank, you receive training and mentoring by experts in registries and biobanking. I work with you to set up your systems, and I'm very available. And it's a great opportunity where you get mentored through this process. We have templates for all necessary documents and protocols. We have our own IRB. I work with you through this process. We have a clinical data collection system with customizable web-based interface for data entry. We're able to collect multiple biological samples, and we have a robust chain of audits and chain of custody for them. And then we have web applications for data and sample management, so this can be done from anywhere. And then we also have the ability to add on other genomic services as needed. So we contract with a company called GeneLogic located in Gaithersburg, Maryland. We use their TRIMS registry and their biorepository. We have an additional contract with Rutgers University to collect cell lines. We're using private access for dynamic consenting, clinical trials, recruitment, and medical record management, and this is coming on board in 2010, beginning this spring. And then we also have our data mining and analysis tool through Genesis, which is a solution that GeneLogic has developed. So I'm going to show you some quick screenshots of the different pieces of the registry. We also did an in-depth webinar that I will direct you to at the end of the presentation that actually goes through each of these in detail through the software and not just screenshots. But I figured for the sake of time it would be better to just do a quick overview so we could explain the grant. So we have an action request system, and this is a web portal where we request things from the biorepository personnel. This is how individuals get into the system. Member organizations identify individuals from their organization, either staff or volunteers, to enter donors, request kits to be sent, and to accession donors into the registry. So this is the point of entry, whether you're just collecting data or data and samples. We have a clinical questionnaire administrative system that allows the member organization to create and manage users, request users to complete questionnaires, and review questionnaires prior to the data being deposited into the TRIMS registry. We also have the clinical questionnaire interface, and it's the web portal where donors complete the questionnaire. And it's very flexible. Any question can be asked. There are multiple standard fields in TRIMS, but we can add on any additional questions or fields or things that are needed that you need to know, and it's extremely flexible. And again, TRIMS is the database where the data records and the sample information is stored, and Genesis is the data mining software. So this is a screenshot of the action request system, and this is where you enter the individual's demographic data, accession donors, request kits, and you can generate a variety of reports. And then the nice thing about this is the biorepository personnel also enter data into it, such as tracking numbers for FedEx for the kits. So anyone who has web access can use this system to see if the kits were sent, if the kits were returned, and run multiple reports. For our clinical questionnaire administrative system, this is what the screenshot looks like. And this is where you give donors ID numbers and passwords. You generate automatic email invitations to invite people to complete the questionnaire. And what's unique is anyone can complete the questionnaire. It can be the donor themselves. It can be a parent. It could be a provider. And since this is all web accessible, it can be done in a clinic setting at point of care, or it can be done by someone at home. It's extremely flexible. And this is where you can, as the organization review the administrative capabilities, see who has started their questionnaire, see how much they've completed of it, look at the different questions, and then review these questionnaires for data curation before you release it back into TRIMS. And this is what the clinical questionnaire interface looks like, so you can see the entire questionnaire, the mandatory questions, and using these buttons below, you can approve it, you can return it to the participants. There are a lot of options, so it really allows for robust management of the questionnaire. This is what the donor sees when they're filling it out. This is PXC's questionnaires. There's a place for personal information, lots of instructions. This begins with an online consent for people to say, yes, I want to complete this questionnaire. And then there are all of these different sections of the questionnaire that are customized by each member organization. This can be completed all at once. It can be completed in different phases, and all the data is stored, allowing the donor to log back in and complete it again. So this is a section on vision from PXC's questionnaires. The questions and the answers, again, are completely customizable, and this is what the donor would see when they're filling out the questionnaire. Here are some screenshots of TRIMS, which is the Tissue Repository Information Management Registry, and this is where the data is kept. What you're seeing on the left-hand side are the user IDs, and then you can see the tree of specific data. There are standard TRIMS fields and then unlimited fields that can be customized. In TRIMS, they manage both the physical sample inventory as well as the data, and there's the opportunity for reports, and it uses SNOMED-controlled vocabulary. And again, numerous screens for workflow, and there's a unique interface that we can visualize a lot of data. We also have Genesis, which is a data mining software, and it's a visualization and query tool. So what you're seeing here is we're setting up a query through a Boolean expression where we want to look at different things. You can use ands, nots, or you can exclude for things. And what's really neat about Genesis is you can save your queries, share them with other users, and you can create this wonderful visualization chart. And I know this is probably hard to see on the webinar, but there's a really nice demonstration of it that we've recorded that I will direct you to at the end. And you're able to generate tables, develop cohorts, and then visualize specific tables of data you're most interested in. And so for our different members, we've had the gene discovery for PXE and CFC have both come through the biobanks. PXE is licensed to diagnostic and is moving forward with genomic and biochemical studies. The National Psoriasis Foundation has received an NIH challenge grant to genotype their samples in the biobank, and HAE is using this for adverse drug reporting for FDA approval. So there are a lot of different ways to use this. It's very flexible. In order to be a member, we ask individuals or organizations to complete an application, and it's just a design that the organization is really ready to take on a project of this magnitude. It does require a certain amount of resources, both people, and these can be volunteers, but it requires dedication, commitment from the board and the leadership of the organization, and then financial help. This application is reviewed and approved by a biobank committee, and we also have a tools and training module that I've been mentioning on our website, biobank.org, where one of the things we're really trying to do is to impart some of this knowledge because we know it isn't easy, and we have a lot of experience, and when people are beginning this, they have a lot of the same questions. So we held a boot camp in January, and we have enduring materials that are on the web, a lot of worksheets to help think about things you need to think about to start a registry or a biobank, as well as in tools to assess organizational capacity and tools to use when selecting a vendor. And I think, definitely these tools can be applied to looking at the Genetic Alliance Biobank to see if that's a good vendor for you. We also have a listserv that we've been using to generate discussion and to connect individuals. We have webinars, and this webinar from February 3rd really details all of the software programs I mentioned, and we're also starting a newsletter that will launch later this month. So we're really trying to develop tools to help train the community. And this was a quote from one of the participants in one of our biobanks, that seldom is it that ordinary people like myself get to participate at any level in extraordinary events. I see donating blood to the biobank as one of those events. I mean, this is something that can really be impactful, can have a great impact on your community, and it can also really accelerate research for your condition. And so with that, I want to turn it back over to Kristen. I know that was a quick overview of what we do, but I'm happy to answer any questions as well as talk to people one-on-one to help figure out if the biobank would be an appropriate solution for you. Kristen?
Thank you, Liz. That was great. I hope everyone was able to get a lot out of that quick overview. As you all can see, we've put the agenda back up, and we just concluded our brief introduction of the Genetic Alliance Biobank by Liz, and I'm going to now jump into the Biobank grant opportunity. So just to give you a quick background, the staff here at Genetic Alliance was given an opportunity to take a sort of pot of money that we have and create our discretionary fund, and take this opportunity to really design a project or a program that was not already something we were doing as on our normal sort of assignments within our own program areas. So we sort of came together as a staff and decided what is an impactful way that we can use this sort of pot of discretionary money to further our mission, further the work of the organizations that we currently partner with. And we felt like the Genetic Alliance Biobank was a great way to connect and advance everything that we're doing here. It's something that we want to support and continue to encourage and build, and it's a part of the capacity building that we feel that is very important here at Genetic Alliance. So with that, we have taken $20,000 to put in a grant, to put together a grant application and put towards helping an organization, either a multi-group organization, a single group organization, or a consortium join the Genetic Alliance Biobank. As you have probably taken a look online, we have created a set of guidelines and put together an application for people to fill out. There's some pricing information. $20,000 goes towards the initial startup fee of $40,000 for a group to join. But I will get to that. We'll get to that within the financial requirements. So with that, I'm going to turn our attention towards the application. And as everyone will see, we're pulling up on the screen the actual guidelines as they're uploaded on our website. So I just want to take everyone through a quick piece of it. There's a quick synopsis of the Genetic Alliance mission, sort of our focus. We go quickly through to the purpose of this grant program. And as I highlight here, it is within this sort of spirit of capacity building and advancing novel alternatives, have identified this opportunity to offer a grant of $20,000 towards the startup fee for membership. Here we are with the guidelines of the grant application. I want to point out a few key items in the timeline. We made available the opportunity to apply for the grant application March 1st. The application period is March 1st to May 1st, and we will be conducting a 3-step review process of which the administrative and capacity review will be complete by May 15th. What that means is we will be letting groups that have applied know if they have met all of the capacity and administrative requirements, if they're okay. If between May 1st and May 15th we find that there are some elements to the application that we still need more information on, we will be contacting groups and asking them to either submit if they have forgotten a required material or if we need more information within an area. Once that is completed, we will then be giving the applications over to a group of outside reviewers and Genetic Alliance staff to review, and I will actually go into that a little bit more later on in the guidelines, but just to finish out the timeline, grantees will be notified June 15th, and we will be actually announcing who the winner is, who the grantee is, and sort of this whole grant application and program at our annual conference, which is July 15th through the 18th, which I hope everyone will be attending. The grant period is for 1 year. So beginning August 2010 through August 2011, there will be you will always be working with Liz once you join the Biobank, but there will be a few requirements and reporting requirements and pieces that we will be asking of those who do, the grantees that do win. Wanted to point out one thing is that we are asking grantees to attend, those who are awarded the Genetic Alliance Biobank grant, to attend our annual conference. We are offering a stipend of $500 to at least 2 members of the grantee organization, and we will be acknowledging you, as I mentioned earlier, during the conference. So that is just one key thing. And hopefully you were already planning on attending the conference anyway, which registration, by the way, went live this week. I'm just doing a little quick plug there. So quick review of the evaluation and review for the Biobank grant application. Step 1, as I mentioned, was the administrative review. We will be looking at all the documents submitted, just making sure that you've met all of the document submission requirements. That's the financial documents, that we have your application information, that all of the parts of the application have been populated, as you'll see later on down the line. Just sort of more administrative tasks. Again, that 2-week period, we will be connecting with you again to make sure that you have, if we are missing something, that you do get that to us, so that you will remain eligible for consideration. Next, we'll move on to anyone that meets the administrative review piece will be moved on to the capacity review, which will be conducted by the Genetic Alliance Biobank Advisory Committee, which you saw in Liz's presentation, who the members of that are. This is really the part where they will evaluate, as in evaluating anyone that applies to be a part of the Biobank, your capacity to have both the human and monetary resources to be an active, sustainable member of the Biobank. So this is where you see the grant opportunity and the already the practice guidelines that we have in place for joining the Biobank come together. Next, we'll have step 3, which is the Biobank application itself, reviewing that piece. There are narrative requirements as well as requirements that those who are applying are currently using Genetic Alliance tools, and we will be selecting teams of reviewers to review each application, and then we'll have teams of reviewers are consisted of 3 people, 2 outside reviewers, and 1 Genetic Alliance staff member. Then we will also be having the members of the Genetic Alliance staff reviewing the Genetic Alliance tools. A grantee will be selected based on the highest score. And you're probably asking yourself, what does that mean? Well, scoring system is explained further in the application. If needed, we will have a selection committee convened should there be a tie or almost tie, which, as we've written, is defined as a less than 5-point difference between two applicants. And scoring system, just to let you know, we have a 100-point scale, and we will be evaluating the narrative components on a 75-point scale and the usage of the Genetic Alliance developed tools on a 25-point scale. And as you can see here, is sort of the role and selection of outside reviewers. Again, this is a part of the guidelines and application package that is currently up on the Genetic Alliance Biobank site. So this is just a quick overview for you all, and obviously to answer any questions. As you see here, this is a general executive summary of the biobank, but Liz has covered a lot of this within her presentation, so I'm going to quickly scroll through it. This gives you an idea and a snapshot of the current Genetic Alliance Biobank costs, and as well as the governance, the Biobank Advisory Board, so you'll sort of see the members of folks that we will be asking to participate in step 2 of the review process. And now we're getting to the grant application. This first section really is just your contact information and all of the key parts of, again, who your organization is, your tax ID number, all of the sort of key administrative pieces. Sign off by both the Chief Executive Officer and the Chief Financial Officer within your organization, multi-group organization or consortium. Again, we'll have some instructions. Please note these when creating your narrative piece and also when submitting. We are asking that everyone submit via email. We are greatly trying to reduce our impact, our carbon footprint, as well as our paper impact. So please, it's so much easier if we receive everything by email, which has been, if we scroll back up, is at the gabiobank@gmail.com. We've set up a Gmail account as a way to make sure that we do receive and that nothing gets bounced back within the Genetic Alliance server. So that is why we set up a Gmail account, to make sure we could, in case a application package is large, that we can still receive it. All right. So briefly, we are asking applicants to complete an executive summary, a grant summary, which includes a narrative piece, which in turn includes background, funding requests, and sort of, again, the part where we evaluate your current usage of Genetic Alliance tools. We will then be asking for financial information, and this section right here is directly from the current Genetic Alliance Biobank application. So again, this speaks to your organizational capacity to be an active member and a sustainable member of the biobank. We have here other supporting materials, and then we get into a little bit more about the evaluation and selection criteria, which we explain what sections of the executive summary, background, and funding request areas of the narrative will be, how the sort of points, how they're weighed within the 75-point total, and then also what we're looking for when evaluating your current usage of the Genetic Alliance tools. So I'm going to go back up a little bit. What I really want to emphasize is we're really looking for your goals and your sort of asking yourself, how would this experience not only advance the work that you are currently doing at your organization, the population you're serving, but also the collaborative aspect of it. We really have emphasized with our work through the biobank, the Genetic Alliance Biobank, the collaborative piece of creating a registry. And it's a different take on building registries, and so we really want to look at the ways, we really want people to emphasize the ways that they would bring a collaborative voice to the work that we're doing. Anyway, I wanted to really emphasize that piece of it. So just those are the sort of things to keep in mind when creating your application and when you're explaining how you would really see building your own biobank. And within being a part of the biobank will really advance what the work you're doing now. So I'm going to actually turn it back over to Liz to speak a little bit about the financial information and requirement piece, because that is a huge part of what the biobank currently evaluates when evaluating applications and new members.
Thanks, Kristen. So one of the requirements for being a member of the Genetic Alliance Biobank is that you are a nonprofit organization. Genetic Alliance Biobank, Genetic Alliance Biobank originally started as a separate 501c3, and then about 2 years ago, it became under the Genetic Alliance umbrella, and it became a program of Genetic Alliance, but Genetic Alliance as well is a nonprofit. So we limit membership to nonprofits. So we need the IRS determination letter. We would also like a copy of the most recent IRS Form 990. And we ask for the management letter, which is from the independent auditor's report. And that's usually standard practice in a nonprofit, just to ensure that the books look good. We also would like a one-page organizational chart of the individuals who will be working around the biobank, and this could be staff or volunteers. And we need short biographies of who these individuals are. And with our different member organizations, it's usually about 2 to 3 individuals that are working on their biobank, either volunteers or staff. We also would like copies of your board of directors roster and your professional advisory board roster. And again, these are 2 things that you probably already have. A copy of the D&O insurance binder, and then 2 letters of support, one from the board president and one from the chair of the professional advisory board. Now, we know that organizations are set up different ways. Some of you might have a medical advisory board. Some of you might have a scientific advisory board. That's fine. What we're really trying to make sure is that the people, so the board obviously controls the financial resources of an organization, and we want to make sure that the board is behind this project and that the board thinks it's an important direction to go, and then that the professionals in the community feel the same way. And then we would also like 2 letters of recommendation from your community, so from either an affected member or a family member, and then from a researcher, stating that this is something that's really needed and is going to advance research in the community. And again, that's just to ensure that when you're going about this process that you're connecting the individuals that will be donating samples and using samples, and that it's something that has wide acceptance in your community. And this might seem really obvious, but if your community doesn't support this, your biobank or registry won't be successful, and both from the board level as well as down to the individuals in the community. And we've seen this happen before, so that's why we've put this all in place, because we want to make sure that when you start out a project of this magnitude, that you have everything in place to be successful. And then, as Kristen noted, the costs are, which I didn't address in my talk, and I probably should have, but the costs are on the earlier page of this document, and it's $20,000 for an initial joining fee, and then it's also $20,000 a year. So the initial joining fee helps to pay for the infrastructure and the mentoring, and the annual fee helps cover our software licenses. And just so you know, the biobank is not, so we're able to cover all of our costs, but we're not able to cover all of our staff costs yet. Genetic Alliance contributes quite a bit each year to ensure the success of the biobank. So so we don't make any money on this. But we've been around for 7 years, and we are sustainable, and we're not going anywhere. So, and when you look at the costs, what you're seeing on the biorepository side is everything is on a per sample basis. So if you are ordering 10 kits, they're $15 each, that's going to be $150. So all of these per sample. So if you have a collection that's 100 samples versus a collection that's 1,000 samples, the 1,000 sample collection is going to cost 10 times as much. And that's how we've set it up, where everyone shares costs equally for the registry piece, and then the biorepository is based on per sample. And I'm happy to talk to people individually about what this would look like and for your unique situation. I know we're speaking generally here, but again, both Kristen and I are available to help address any specific individual questions. And I think I'm going to turn it back over to Kristen, and she can continue with the application.
Thanks, Liz. Again, I want to let you know that while we ask quite a few questions here, we do that mostly as a way for you to be succinct and get right to the point. We provide a 1 to 2 page limit for the executive summary and a 3-page limit for the narrative. And we would appreciate you addressing all of these areas, as these will be the areas that you will be evaluated in under the background, the funding request, and of course the Genetic Alliance tool, usage of the Genetic Alliance tools. Again, you are all probably very familiar with filling out grant applications. However, I do want to make sure that should you have any questions regarding that we can answer them right now. Again, as Liz said, we are available to provide you any background, or if you're kind of confused about one way that we are phrasing something, that opportunity to sort of bounce questions off does exist outside of this webinar. However, we just want to remind folks that May 1st is the deadline for getting it in, and that's close of business on May 1st. And again, GABiobank@gmail is the email to submit your application. And I don't see any questions, so we will now be turning it. I guess we're just going to conclude here. I want to thank everyone for joining us today. Again, should you have any more questions about the application, about joining the biobank, questions ranging from am I eligible, what does this mean, please feel free to contact Liz or myself, and we are here to provide any support that we can. We want to thank everyone for joining us today, and hope you have a great day, and we hope to see applications from everyone who was able to join us. All right, thank you.